uh, fun being in a leap year right now. We're on the leap day, February 29th. It's a leap day. Um, I always forgot when the leap year was, but it's yeah, we're in a fun little place right now. And we have March coming up tomorrow, and March is nutrition month. And as a result of March being nutrition month, the dietitians, of course, love to pick a theme that we can focus on for the month of March. I guess Dietitians of Canada that comes together and says, what do we want to focus on this year? And this one, the theme for this year is We Are Dietitians, with the intent of igniting pride across the dietetic community. And I think this is, I'm not going to lie, when I first saw this one, I'm like, where are we going with this one? Is this just, it just had a very much like this is kind of, I feel like we've done something like this before. But I think the cool thing is that we are in a place right now where there's a lot of noise in the industry. And I feel like being in private practice, we definitely see that. I would say, I would argue more in the private sector. We have to position ourselves in such a way that makes us, it makes it clear that we're the expert, but then also we're not patronizing people and being condescending. So this episode is all about what I think it's going to be about. What are dietitians actually doing? What do dietitians actually do? I give you a bit of an intro to dietitians, where to find them, what we do, what are some myths, and give you some pointers when you're looking for dietitians if you're wanting to work with one at any point in the future. So let's kick us off. Let's get into a little bit about what one has to do to become a dietitian. This one's kind of, well, I don't think it's really commonly known about how you actually become a dietitian. I find people that I've talked to, anyways, there's always like, "Oh, what do you got to do that?" And is it just like a 1 year like certificate thing? And I always roll my eyes because it's nowhere close to that. But hey, got to start somewhere. Um, yeah, who wants to take this one?
Sure. So for becoming a dietitian, it is quite a long and difficult process, not like a 1 year course as we spoke about before. So there are going to be slight differences in programs, but generally speaking, someone will need to complete 5 years total of education, where usually 4 years of that is coursework that is based in largely sciences. So things like chemistry, biochemistry, biology to a lesser extent, as well as physiology, just to have an understanding of different parts of the body and how that may include and interact with nutrition. So after 4 years of those types of courses are completed, the person then moves on to an internship, which is essentially just supervised practice over the course of that year. And the goal there is to apply the knowledge foundation from those science-based courses into actual practice in different settings. And that would be, for example, a clinical setting in a hospital, some settings that are more management focused, where that person will be learning to how to manage food services in a setting like a hospital or long-term care facility, as well as more community-based placements where the goal is more health education, public health, health promotion, that kind of thing. And I should also add that with regards to the coursework, it isn't all just that clinical foundation. There are also aspects of those management concepts, as well as those more health promotion and health education concepts. So the goal for a lot of programs is to give people a taste of essentially all three of those main categories, and then have them apply that in the placements, and then move on to the subfield that they feel that they most align with.
Yeah. And then to keep going with that from the education component, and I think this is a piece that we forget when people ask me, what's the difference between a dietitian or a nutritionist, or, a nutrition person, or who's got like just one course or something, is registered dietitians are regulated under the Health Act. So we are held by provincial bodies to be able to do that work from that training and those courses. So we are a protected profession, just like any other professions, whether it's nursing or pharmacy or doctors. So we are held, which then I think makes that, when we're seen as kind of those experts, that is holding us to a different level, because not just everybody can work, in any settings. You do need that regulatory body from a practice, from a safety, from evidence-based, from health. So we are held to very, very high standards, which I don't think people quite put together always.
Yeah. I often find that because we're talking about food, it's a little bit more nonchalant with what people expect of us and our profession. We have a pretty lengthy code of ethics, as most, if not all, healthcare professions do, into what they have to adhere to, from everything to the training and maintaining competence, to even things like promotion and advertising. Like, we have to adhere to a lot of very strict criteria to comply with our code of ethics put out by whichever provincial regulatory body is for that province. And those pieces mean that we can't just go do random stuff with random people and just kind of do whatever we want in the name of, well, capitalism and profit, or even just something as simple as, I want to help this person. There's a lot of pieces that go into it, and that does have its challenges, though. There are definitely cases where I have found it to be kind of a pain in the butt that there is such strict criteria. It is limiting in some aspects, particularly from like a marketing perspective. But I think at the end of the day, it allows us to focus really, hyper focus on patients, clients, because that's ultimately what we're here for. We can talk about like, oh, it'd be nice if we could do this with marketing instead. And, we have these constraints and stuff like this, but ultimately everything in place, from the education to protected titles to making sure that you understand that a registered dietitian across the board is a registered dietitian, and you don't have to worry about differences in competence unless we're talking about specific focus areas. That's where the confidence in the profession, that's what we're trying to do, because ultimately it's for all of you, all of the people that are listening, that may need support from a dietitian at some point. Now, we got into this a little bit already in terms of where dietitians actually work. We're Revive Wellness. We're in a private practice. We're a business separate from the provincial healthcare system. But there's other places that dietitians can work, depending on the focus area, depending on whatever the objective of that particular sector is. Matthew, I think you spoke a little bit about some of these examples. Can you dig into those a little bit?
Yes, to speak a little more in detail about those different subcategories that we spoke about where people work. So the largest share of dietitians will be working as clinical dietitians, and this can look different depending on the setting. So broadly, in a clinical setting, a dietitian's role is to identify and then treat malnutrition, meaning that those who in hospitals and other places that are often undernourished, because malnutrition in hospitals leads to a lot of bad outcomes. And this includes things like people needing to stay in the hospital for a longer amount of time, taking longer for people to heal, and even just decreasing chances of survival in some situations if someone's undernourished. So dietitians in those settings work to ensure that people are being nourished enough to be able to stay strong, to heal, and to recover. And this often does not just include food, but other means of providing people nutrition. This could be things like feeding people with tubes that you may have seen in places like the nose or into the stomach. And also, some nutrition can be provided through IV as well in some situations where someone's digestive tract is not working, so they aren't able to eat food not able to digest foods in normal means. So that would be the focus in more hospital and other clinical settings. Some dietitians also work in food service management, and you will see these dietitians in hospitals and similar settings as well, but their role is more so managing the food services of the hospital and not as much interaction directly with patients like clinical dietitians. The other main category is going to be community dietitians, and they largely work in community settings to help people to try to improve health at a population level, whether that be through some kind of programming. Some may work in more of like a policy-based role, but the goal is really to help to improve health at that population broader level. And on top of that, within all of these three main categories, research can be a component where maybe someone is researching the effectiveness of a community program, if it's more community nutrition based. Maybe they are researching clinical outcomes with certain interventions, or maybe they are researching different ways to maybe make a food service system more efficient or something like that. So research can also be a component within those three main subcategories.
Nicely put. That was very well done. Yes. I think a lot of times when people consider that what dietitians do, I think we'll get into this with the myths piece, but there's such a wide array of areas that dietitians work in that are just not super acknowledged because it's not fancy dancy, and it sometimes often doesn't get a lot of media attention, but they're there and they're having a huge impact on a variety of people's lives, either at a high level, on an individual level, or on a more systems operational level. But let's dig into private practice, because out of all of these things, we at Revive are in a little sector of our own in the private sector, meaning that we are a business that operates separate, like I mentioned, from the healthcare system. And we do very similar things as to what outpatient dietitians do, provide counseling or coaching. Those are kind of synonymous in some ways. But Andrea, why are private practice dietitians so awesome?
Yeah, so I think, and I have a different perspective because I have been in the public health sector. I've been, in primary care, and I've done the clinical and alongside of that. And then, this private practice takes it to a different level within public health, or within the community or clinical. Sometimes you don't get to see people as often, or there's longer wait times, or maybe they're ending up seeing me where it's not something that I practice in very often, but they're coming to me because it's within a public system. So one of the things that's really, I'm just going to use your term, awesome about private practice is we have the ability to match people with what they're looking for to what the practice is, and spending more time with them, spending a lot more. My clients always come to me, and it's not so much the knowledge, they want the hand holding and the support and the accountability. And that's hard sometimes to get within the health system. So looking for people to be that on their support team, and private practice really, for me, with my clients, that's that bridging that gap a little bit of having that person on the private practice side to be a little bit more involved in their care. So that is what I truly think is very awesome about private practice. Is just extra support for people who do really need it and are looking for it.
And we have more time Typically, we have a bit more time, and because in private practice, people aren't coming to with our practice, anyways. I don't want to generalize, but with our practice at Revive, we're not an urgent care type practice. We are a practice where people who have identified challenges or goals or outcomes or problems that are a little bit more longer term. They're not super like, what's the word? Jeopardizing their health from like an acute perspective. So because of that, we have a bit more time and we have more of an ability to slow things down, at least when we're starting with somebody, to figure out what's the goals, what do we want to do here, how can we support people, what's the actual root causes of some of the challenges they're having, to make sure that, like you said, they are with the right person and they're working with the right dietitian. And I mean, this gets into the benefit of not only why is private practice so awesome, but why is Revive Wellness, the private practice, so awesome, is because our team is so robust that we cover so many different areas in many provinces, not just Alberta, but also British Columbia and Saskatchewan. But our focus areas are all different, which means that we can have clients come to us with an array of challenges, and we have a whole team to draw upon to help support that one person. And as is the case for for private practice dietitians that have multiple dietitians working on their team. But I mean, I'm obviously biased because we are Revive Wellness. So obviously, I'm going to say that our practice is awesome. No bias at all there, of course. Any points to add, Matthew, to the private practice side, given that you're also one of the dietitians on our team that is relatively newer into private practice? Anything that comes to mind that you want to add?
No, I think you both covered it well in that, yeah, a lot of the benefits are, like you said, generally having more time that you're able to spend with clients, as well as even like behind the scenes type of work, and a greater ability to, yeah, match a client with a provider. I think that that is an essential piece where, like you said, Andrea, in a primary care setting, you could be, yeah, you could be seeing anything and everything, and it takes, yeah, and it takes a very, very long time to have all of that knowledge base where it could just be anything versus being able to specialize in a certain area or a few certain areas and being able to, yeah, choose and being able to either accept clients that are within those areas or refer to someone else on the team that has a different special skill set. So I think that that is the main thing that I would say sets it apart from some more public settings.
The other thing, and this will seem like a small thing, but it ends up being a really big thing right now. So we know in, some provinces, specifically Alberta, where there's a lot of people who are not connected to doctors. So a lot of times to access people like dietitians within the system, they require a referral, or they require a network, or they require somebody connected within that. And right now there's a lot of people without a family doctor or medical home or medical team. So that's one of the kind of barriers that private practice can do, is most don't like, I can definitely speak for us, I can't speak for all, that it doesn't require referral to come and see us. So if it's just something, hey, you know what I want to do, that we don't have to worry about going through the hoops and hurdles of that. I mean, it's not to dismiss, going to your family doctor for things too, but not all connections are there. And I've seen that before too. So it's a barrier that it removes.
It's an excellent point. It's a very good point. Matthew, something to add?
Yeah, another thing that I'd like to add that is specific to Revive, but also to a degree with some private practices, is greater emphasis on both creativity as well as technology integration. So at Revive, we're able to use My Viva Plan with clients in order to help with the behavioral components and being able to help with those being able to help set up those meals and all of that in a way that is customizable and easy to use, which I find is going to be, which I find is more effective for people than, it gives an effective and easy way of self-management and tracking without it being anything overly time-consuming or overly obsessive, which is quite helpful for some people. And another aspect relating to the creativity piece is just that being able to, it's less limiting in terms of things like developing resources or being able to either develop or refer to resources and provide those, versus with in a more of a public setting, it's more, there are specific handouts that you have to go over, whereas with a setting like here, you could like make a new one or revise an old one pretty easily without a long process involved in it.
Funny enough, that those pieces that you just mentioned are one of some of the reasons that drew me to private practice when I first became a dietitian. When I was done my internship, I went straight into private practice, and I had a choice that if I wanted to go in a different direction, that was the fork in the road. And those pieces were the pieces that were the deciding factors for me to join the team at Revive. And because, that actually is super underestimated, the impact that has, not only on patient/client care, but also then the practitioners too. That creativity piece, using different solutions, digital focused, all that stuff. Like, I wouldn't have been able to have that same level of freedom from a practitioner perspective. So I love that. Those are excellent points. I want to get into my next piece here that always brings some saltiness to it. So let's talk myths. Now, we have a list here. One fun thing I added to this right before we started recording is, what is your pet peeve? Like, if you were to pick one pet peeve when it comes to myths about dietitians, could be something that's on this list, could be something else. But I want to kick this segment off with that question. Who wants to go first? Who wants to jump in with what your pet peeve is? I am very interested to hear this part.
I can.
Do we have a limit?
I was gonna say I could go. To narrow it down to one would be hard, but I can start with one and then we can.
Go for it.
Probably the biggest one is the pet peeve that they're coming to me thinking that I'm just going to make them eat like celery sticks all day long, and they can't eat the foods that they enjoy, and I'm some sort of food police, and going to be judging them really hard on what they're doing. So the pet peeves are coming to me as this, like, the only way I've described it is a food police. They're just coming as like, I'm a fun food taker awayer.
Yeah. Mm-hmm. Yeah. Love that. Yeah. Love that one for sure. Hey, yeah, I could go into that one. Matthew, what's yours?
Yeah, I would agree that is the biggest, but just to name a couple of others, and a few other big ones would be that we are going, so some people view it as just a focus on like weight loss and meal plans, where most of the time it will not, most nutrition counseling is not going to be a formal, strict, like, follow this plan. It is largely going to be working collaboratively to set goals and work on strategies for them to improve their nutrition to reach what their goal is. And for a lot of people, the goal is not going to be a weight focus. For some people, it might be more of like chronic disease management, where it could be something like high blood pressure or diabetes, and focusing on like biomarkers like that in blood work. And another thing for me is also just working with people with more so with like weight gain, which surprises some people, where